Day, which is on the 1st of April, we put together a multi-agency team that we sent to the ground to assist the school with the investigation and management of the cases that had been reported by that time. Today, as of Wednesday, which is the 5th, following my visit to the hospital, so we have noticed that a total of 108 cases of gastroenteritis, which is a stomach disease, and it has resulted into 2 deaths so far, which have been reported. A majority, 68 of them, were managed as outpatients, with only 40 being admitted. To date, 26 of them are still admitted, 14 have been discharged. Of the admissions, 9 of them are at the Kakamega Referral Hospital, and I have been there. I have seen the 9 girls, and 17 are at Mukumu Mission Hospital. One student who was critically ill from that number had been taken to ICU. From there, yesterday they were in HDU, and as of this morning they were now discharged to go to the general ward. I have managed to speak to the girl. She is in good condition. She's up and in the next few days, from the doctor's advice, she should be discharged. So preliminary patient samples collected have tested positive for something called enterotoxic Escherichia coli, which is a bacteria, and also for Salmonella typhi. I think 4 of the samples tested positive for that, and amoebiasis, 3 of the samples tested positive for that, and these were tested at the Cambridge Specialized Laboratories in Kisumu. It is noteworthy to state that patient samples tested negative for cholera, which many people were suspecting that it could be the case, but so far all of them have tested negative. And as you are aware, we are dealing with the Marburg virus in our neighboring country in Tanzania. We also had suspicion that that could be the case, but so far this has been ruled out. In addition, environmental and specifically water and food samples have been collected for testing at the government chemist, and I'm sure we also have an officer here with us from the government chemist, and other samples have been taken to the National Public Health Laboratories for further investigations. Further, the field investigations pointed to possible water contamination at the water reservoir. In the case of Butere Boys High School, 97 students reported having diarrhea, abdominal pain and vomiting following breakfast. Most, 87, were managed as outpatients at Butere Level 4 Hospital, with 10 admitted at St. John's Hospital. So far, all have been recovered, and this morning we have received good news that they have all been discharged from hospital. All patient samples collected also for Butere tested negative for cholera and Marburg as well. In the meantime, outbreak investigations are ongoing with environmental and food samples collected for further testing at the government chemists and the National Public Health Laboratories. The government is bound to ensure that the affected schools reopen in a safe environment and in a timely fashion. A government multi-agency team, in a close collaboration with the county government to treat all water sources and improve sanitation facilities in both schools, is going to be put in place. Further, we wish to assure the public that as a ministry, as a government, we are committed to ensure Kenyans are able to access quality healthcare of the highest possible standards, attainable as indicated in our constitution. So besides this, from morning, when I visited the girls, I managed to speak to almost all of them. Maybe 2 are the ones who are asleep, and we didn't manage to speak to them. And similarly, we spoke to parents and guardians who are there with the students, and so far they've said they have received good management from the county referral hospital. So I really want to applaud the county government for the good job that you are doing. And from my discussion with them, they also said they are stocked up on hospital supplies, which is a very good thing, because in most counties we are seeing cases of out of stock for medical items and commodities. But at least in Kakamega, the doctor in charge, Dr. Murila, confirmed that she was stocked very well. And the other issue and the challenges about the health workforce, that is a discussion that is ongoing, and we shall deal with it. From the hospital, we have been at the school, of course, gone round the school with my team and PS education. We have been to several places within the school. We have checked their kitchen, we have checked their storage for dry commodities, we have checked their water storage and all that, and we have identified some gaps that need to be dealt with. And from there, and from the initial analysis of the issue having been with water, that's how we came also to the main source of the water, which is a stream down here, which we have also looked at and identified gaps. So what we have said is that today we may not be able to resolve everything, but we are going to put together a multi-agency team across all government. From my observation and in discussion with the PS for Education, we have agreed that we'll put together a team from the Ministry of Water, because this being a mainstream that is serving the school, and from the water that we have seen, it could serve a huge a huge population from Kakamega. Our suggestion is that the Ministry of Water comes in and takes care of the water. Actually, they should be able to take care in terms of maintenance and treatment of the water. So I'm going to reach out to my colleague, Alice Wahome, CS for Water. We have also, as we were crossing, because you know the girls are on that side and they come this way to the field, we've noticed that at the road, in terms of crossing, it is a challenge because motorists are there and the road is quite busy. So in the interim, I'm also going to speak to my colleague, CS in charge of roads, so that in the short term, they should do bumps and put zebra crossing signs so that motorists can be able